our system is very good. But the problem is we are more focusing on fixing the damage caused by a problem.
Overhydration, surprise, surprise, can kill people.
You have a patient with coronary artery disease.
Yeah.
We have excellent stents that we can put in and save the patient's life.
Welcome back to another episode of Miles of Meaning, and today I'm here with a very good friend of mine, Enoch. Enoch, how are you?
I'm fine, Rajat. How are you?
Good. So Enoch is the only student president I've ever had. So he was the first and the only and the last president of our medical college. Other than that, he's done whatever else. And, we were the first batch of our college called Manipal College of Medical Sciences in Pokhara. So back then, those were challenges, right?
That's right.
There was water coming and there was no electricity or not coming, and we were
That's
trying to
right.
figure out life. Back then, we were complaining. But then as we carried on in life, how important was all of that, those struggles that we were doing? You being the representative of student body, all that stuff. How did it help? I mean, all of it did, right? How did it help?
Yeah, as you rightly said, we used to complain a lot then, but those were very valuable experience in life because we had great professors with us from Manipal, like Dr. R.P. Pai, Dr. Nagara, Dr. Siraj, Dr. Shetty, and all these people actually they guided us through every challenges. They assured us, they taught us how to handle these challenges in life. And I think those lessons are very valuable, and that has made us what we are today.
Brilliant, very good.
That's right.
Pretty much a startup, right?
Yeah.
Entrepreneurs, startup,
That's
things
right.
going wrong, how to fix
And
them.
if you look at our batch, almost everybody are doing very well in our batch.
Yeah.
And I guess this is the reason for that.
Yeah, no, totally. And how would you compare, your elder son, he's in the third year, he's written his exams.
That's right.
The younger ones, looking forward to getting to a medical college.
That's right.
Now, how do you see then the medical college and how, the ones that are currently versus ours?
Okay.
And how should it be?
Yeah.
What's your take on it?
See, of course, we enjoyed the integrated system, which is very good. But that was a very good initiative taken by Manipal.
It was an experiment. It wasn't like a very tried and tested thing, no?
That's right. But see, I'm glad they thought in those directions because, just independently studying subjects.
Before that, just explain what does integrated system mean? Yeah. How are we different from a regular college?
Yeah, basically they were trying to help us to connect with anatomy and medicine and surgery and physiology,
pathology.
That's right. So they were trying to help us to connect with this subject. And so they made the syllabus that way, and also the classes were designed to follow this particular pattern. And so, which was a very good initiative, and but I don't see any medical colleges carrying forward with that initiative.
Let's spend some more time on this.
Okay, go ahead.
Anatomy, referring to the skeletal system and whatever is in the body, the viscera, all that stuff, nerves and arteries and all that.
That's right.
And so, how is it then connecting to? Let's talk physiology. Just say a little bit more. So, what is physiology, and then how do you connect? You read the similar chapters. Just say a little bit.
See, I remember one incident that I had with one of our pharma professors. Like, I went and asked him. I said, sir, in physiology, we study that the acid secretion in the stomach.
What is physiology? Let's break it down. Let's make it very simple for the audience. What is physiology? Anatomy is the structure, right?
That's right.
Physiology is?
It's basically the study of the function of normal function of each organ in the body.
And then then pathology?
Pathology is basically when something goes wrong in a particular
physiology.
Something goes wrong with that physiology, and what really happens in that particular organ.
Right.
That's pathology. Microbiology is basically the different types of germs like bacteria, fungus, virus, spirochetes.
Very cellular level. Very
How,
microscopic level.
Yeah. How these germs affect your body. We study on that about that. So Now, when I asked my one of our professors about
Pharmacology.
like pharmacology
So
professor,
again,
yeah, go
I'm
ahead.
sorry.
No problem.
Definition of pharmacology, because again, I'm just trying to break it
Yeah.
down for the audience. So what
That's
is
right.
pharmacology?
Yeah, basically, we study about pharmacology is basically a tool in our hand to solve problems, to fix problems, and so we use a different type of drugs.
Yeah.
We study the nature of different type of drugs and the mechanism of action and how much to use and the side effects associated, and we were taught as to use it, to weigh the pros and cons and then use these drugs.
Right.
So basically, they were tools in our hand to handle
Right.
the pathology or to fix a problem.
Yeah. So basically, we'll be studying a body part.
That's right.
Then we'll understand the physiology, like what is the normal functioning.
That's right.
Abnormal functioning, microscopic level.
That's true.
And then how can we help pharmacologically? I mean, all I'm really trying to do for the audience is what does integrated mean? I mean, that's how we were going about it. Like in the same week, we'll do all that.
That's right.
In my head, it never made sense because somehow I was not told enough to connect those dots.
That's right.
Now it makes a lot of sense now.
Exactly.
Yeah.
Exactly.
So somehow we it was too much of an experiment. I think it could have been a little better, but it's okay. Now, you were saying about pharmacology. So what happened with the professor?
Yeah, I'm glad that you're trying to bring this particular point, because unless and until we are able to connect the dots, it's really not going to make sense in our mind.
Yeah.
And how are we going to help our patients?
Yeah.
So it's very important that, you remember, if you take anatomy, we used to have applied anatomy.
Applied anatomy.
We used to have applied physiology.
Yeah.
I mean, that's very, very important.
Come to think of it, applied anatomy and applied physiology is pretty much functional anatomy, functional physiology, if you think about it, right?
Exactly.
Yeah.
Exactly.
Yeah.
So, let me come back to that story with one of our pharma professor.
Yeah.
I went and asked him, sir, we are talking about H2 blockers and proton pump inhibitors. Basically, they stop the acid production in your stomach.
Yeah.
And you say that is going to help in healing the ulcer.
Right.
But
so they're stopping something that's physiologically happening.
That's right. That was my question.
Yes.
Now, this is a physiological process,
normal
physiological process, which is very important. Now, why do we stop that? And then how can we get a positive impact?
Yeah. So we're stopping nature doing its work.
Exactly. So that was a very big question in my mind in those days. I was very troubled about it. And I went and asked him, and he just told me something. Enoch, you have to accept this, and this is how clinical practice works.
This is how things are.
This is how things are.
Yes.
And yes, I respected my professor, and I took his viewpoint.
Yeah.
But still, I could not accept it fully. And but that's when my search started. I said, there should be something beyond this.
Right.
Yeah. And there is something that is missing.
Right.
And so that question constantly troubled me in my life.
The one that worked for me, I mean, this is very interesting that you shared this,
Okay.
Was my dad in 98 or 99.
Okay.
He had a stroke. I had not seen him.
That's about 26 years back?
That's right.
Okay.
And I remember where this whole incident happened, actually. So I was on the stairs right next to the library.
Okay.
Library was a very alien thing for me. So imagine me being close to the library. The clinical dean, right?
Okay.
General Shetty, the head of the department for medicine.
Yeah.
And I respected him a lot then.
That's right.
And I asked him, so this is the problem at home, dad's suffering with stroke. And we read all that stuff.
Yeah.
So I kind of knew where's he headed towards the prognosis, all that stuff. And I was like, what do we do? How do we get him out of this? And the solution wasn't any. I mean, what Sir did with a lot of humility, with a lot of care for me, he put his hand over my shoulder saying, such is life. So there was no solution, really. It was like, what is going to happen will happen, that kind of a thing. I wasn't okay with that.
Okay.
Whatever I was, 23, 24, whatever that age was. I was almost irritated, saying, give me a solution here.
That's
true.
True.
You know it all. You're not like me. You're not a student. You're a professor and you've been around for 50, 60 years practicing medicine.
That's right.
there wasn't any solution to it.
Okay.
That was my trigger, saying,
Okay.
listen, there needs to be more.
Mm.
And probably what really made it even more interesting for me was Dad, because he was already walking for 20, 30 years and was into some yoga exercises, couple of hours a day, whatever else. He got him back on track himself without much medical help.
Okay.
Because they had given up. They'd given up in Delhi. My professor was giving up, or our professor was giving up there in Nepal.
Okay.
And he got him back, himself back, courtesy, very common sense stuff, natural stuff. That was my big one. That, was like, hey, listen, there's more to this.
Yeah. This morning, actually, when I met Uncle, and I find him so normal. After 26 years, he's doing extremely well.
It was taken care of. So he kind of set himself on the path to recovery, and within a month or so, he was 100% okay.
Okay.
Which professor said can't be done.
Okay.
And that's what I'm saying. I mean, our system is such. It's not about Dr. Shetty at all. I'm just saying this is the way it is.
Okay.
It should not be acceptable. I think we should sometimes go for it and, look for the path less taken.
Yeah. Yeah. See, Rajat, what I have learned over years is our system is very good, and we have developed more in terms of diagnostic modalities, treatment modalities have improved a lot. But the problem is we are more focusing on fixing the damage caused by a problem.
So let me rephrase. Symptomatic.
Yeah.
What we are doing is a very symptomatic treatment.
For
We're
example,
not going for the base.
Yeah. Let me give you an example.
Yeah.
Now, you have a patient with coronary artery disease.
Yeah.
And so we have excellent stents that we can put in and save the patient's life, and also stop further complications.
Yeah.
So which is really good, it's a life-saving modality. But the same patient develops another block in 3 years, or he develops a stroke in another 5 years.
Yeah.
Now, what's the reason? The reason is because we are not dealing with the root cause.
Yeah.
What's the root cause? Chronic inflammation.
Yeah.
Now, chronic inflammation is a root cause for the atherosclerosis and the block. Now, we are not dealing with that. Now, if you take, for that matter, any disease, diabetes, hypertension, heart disease, cancer, arthritis, everything, a common factor is chronic inflammation.
Yeah.
Now, we are not really addressing the chronic inflammation, but we are basically fixing the damage caused by chronic inflammation.
So the damage caused rather than the cause of it.
Exactly.
Yeah. Yeah.
And I believe we are doing an excellent job.
Yeah.
We need that.
Yeah.
And our system is excellent in that.
Yeah.
But why aren't we focusing on the cause?
Yeah.
Now, just imagine a person has a coronary artery disease. He had an heart attack.
Yeah.
And you do a stenting. He improves. Good. But are you equipping him to handle the chronic inflammation that he will not have any further blocks or a stroke? So that's my question.
Yeah. Even before we get into this is very, very good, and this could be the theme today.
Okay.
But your incident from that Viva of microbiology with Dr. Hegde, what happened? And then we'll carry on with this, because this is very, very, very relevant. So as much as you're being very, very nice to our Western approach to things, but it's very important what you have to say on this. So what was that? What happened that day? Third year, I think.
Yeah, this was third year. I mean, this is really funny. I didn't attend the Viva. There's some internal assessment for 10 marks. And then I was sick or something. And so Professor Hegde, our microbiology HOD, said that, 3 days later, he said, today, you can come today and we can finish this off. So, but I was not ready, And so he asked me, I'm going to ask you 5 questions and I will give you internal assessment based on your answers for these 5 questions. I said, okay. And so he asked me, what's the complication of malaria? Now, I was not prepared, but I also wanted to make sure I say something.
Yeah.
So I said, I thought about it and I said, sir, death. Then he smiled at me. And again, he asked, what's the complication of typhoid? And again, I didn't know the answer. And I said, death. So for all the 5 questions were complication of some disease.
Yeah.
And I just said death.
Yeah.
And after that, he said, okay, you go. but somehow I cleared that
No,
viva.
but you weren't wrong either. Because if you think about it, what is the final eventual consequence?
That's right.
If things go really wrong, all of those guys are actually death.
That's true.
I deal with a lot of runners, all that stuff, and
Okay.
one misconception is that there are two extremes that people have advice on water.
Okay.
While I was in a school in Missouri, the
Okay.
advice on running was don't drink.
That's true.
Even today, most trainers, most coaches would say don't drink
Okay.
water.
Okay.
Or other extreme, drink too much water.
Okay.
Right? 6 liters and 7 liters, whatever.
Okay.
Now, overhydration, surprise, surprise, can kill people.
Okay. That's right.
And so can malaria. But the point really is I'm trying to make is so can drugs.
Okay.
If excessive dose, so can they do that.
That's true.
And connecting with what you were saying earlier, statins
Yeah.
and treating cholesterol issues with LDL, we know the side effects are more than actually the benefits that they have.
True. True.
And that's a problem that we have, as good as medical science is. But there's this whole push from the whole pharmaceutical industry saying go this direction, and we tend to overdo it.
Yeah.
And then problems happen.
Yeah.
What's your take on that?
Yeah, see, definitely drugs play a major role in saving human life.
Yes.
But looking at drugs as the only way of helping people with chronic diseases is not the right path.
Yeah.
Because it is very important that we give sufficient information for our patients, so they can make better choices and avoid always getting into some problem and trying to fix it. So as I just talked about coronary artery disease, where we are only fixing the problem caused by chronic inflammation, but we are not dealing with the chronic inflammation. And I said that most of these lifestyle diseases, the common factor is chronic inflammation.
Right.
Rajat, honestly speaking, do we have any drug to handle chronic inflammation?
Now you're talking. Tell me more.
No,
don't try to be all nice to everyone.
No.
Just speak your mind.
No, the thing is, we really don't have a drug to deal with chronic inflammation.
Yeah.
And so what's the solution for chronic inflammation? Because we know that that's the major culprit for all lifestyle disease.
Yeah.
So the only solution that we have based on evidence-based sciences, what contributes to chronic inflammation? Let's talk about that.
Yeah.
Unhealthy diet, unhealthy lifestyle. And now the big thing that we were so ignorant for many years is unhealthy mental health.
Awesome.
Awesome.
Yeah.
So precisely, if we could focus on these three areas, and if we are able to convince our patients that unhealthy diet, unhealthy lifestyle, and unhealthy mental health is the major factors that is contributing to chronic inflammation. And I'm telling you, we are doing a lot good for our people. That's and we have made programs to address these things, and when we put our patients into these programs, we have reversed diabetes, we have reversed hypertension, we have reversed chronic coronary artery disease, and we have helped patients with cancer with a better outcome. So it works.
Awesome. But let's just go back a little. One of the three you said was mental health, mind.
That's right.
Let's be a little critical. I mean, it's great to say everything's very good, but if everything was very good, we wouldn't be around. Right? So there's some problem, right?
That's right.
Now, what I'm saying is, while we were in a medical college, while we were doing Gandaki hospital internship and all that, or around there, our professors were very good. They were far better than most of the people out there, right?
That's right.
Having said all that, what was your take on the body-mind disconnect or connect? Were we seeing enough of that from the best of them?
See, not at all. Not at all. See, we were very ignorant, and the whole medical field, we have been very ignorant on these areas. But thank God for a lot of information that is coming today. The impact of poor mental health on body and the mind-body connection, and so many studies that's coming up. I mean, that's really an eye-opener for all of us. And I believe, Rajat, in next 5 to 10 years, with such a huge number of chronic diseases, incidence of chronic diseases increasing every year,
Yeah.
our approach to these disease is going to change. Now I heard that there is a lot of mapping going on how this type of poor mental health causes these types of diseases. So our approach and the way we look at this disease and how we handle it is really going to change.
Totally. There's a paper recently that's come out on
Okay.
when I'm talking about pains, aches and
Yeah,
pains,
yeah,
and psychology. What they're saying is when people have depression, anxiety, all that stuff, whatever
Yeah.
psychiatric, psychological issues, and when they're having counseling and they're being prescribed drugs,
Yeah.
but if they're not being prescribed physical activity, better lifestyle,
Mm-hmm.
they're going to the extent of saying, is it pharmaceutical, is it psychiatric malpractice?
Mm-hmm.
Because if you're not doing that and it's as effective
Okay.
as your counseling
That's
and
right.
as much as you're prescribing the drugs, then
Yeah.
why are you not doing it? Because
Yeah.
there's enough evidence to prove that, hey, lifestyle medicine matters, exercise medicine matters.
That's true.
So they're
That's
going so much on, for the psychologist and the psychiatrist, same should be happening for us. Why are we not thinking mind enough?
That's true.
You're treating
That's
the body and not the mind. I mean, come
That's
on,
true.
connect it both, right?
Yeah, see, I'm just amazed the way you're giving results for patients with just your exercise program. I mean, it's having a huge impact. I was hearing about what you have been talking about, how much of relief you're able to give with your exercise program, and which means your exercise program is addressing chronic inflammation. So
Precisely.
Yeah.
And mind. Again, it's always the mind. It's not the
Okay.
exercise alone.
That's
So
true.
the whole mental health is a very important
Yeah.
part of it.
Yeah, yeah. And this is very remarkable.
No, thank you, thank you. So from a medical college,
Yeah.
you ended up becoming an organic farmer. Take me through that journey. What happened there and what were the discoveries? Because here you were giving an example about having a chat with a pharmacology professor,
Okay.
and then you're going so natural, so nature-wise. That journey, and what did it change for you? The whole food angle.
Yeah, actually, Rajat, I'm glad that you talked. You want to talk about this. In fact, I like to be called as a farmer than a doctor because I really enjoy farming.
I like to be called a runner than a doctor, so that's awesome.
See, today we have so much of patients suffering from endocrine disorders.
Right.
If you see more hypothyroid and more diabetes and we are seeing so many children today suffering from these conditions. Now, why? What's the reason? Now, if you see, most of the endocrine disruptors are chemicals used in farming. Now, when I started to do farming, I realized how much these farmers, they struggle to bring out a vegetable.
Yeah.
Number one, the big problem is protecting the seed. To protect the seed, they have to use chemicals. And when you plant the seed, for its growth, you need chemicals. So, and then to bring flower, you need chemicals. For fruiting, you need chemical. Before harvest, you need chemical.
Right.
And after harvest, to preserve it, you need chemical. I mean, all throughout, so much of chemicals are used, and they are one of the major culprit for many endocrine disorders.
Right.
And you're not just going to get away with these chemicals. They are going to get into your body, accumulate somewhere, and definitely cause a major impact negative impact in your body.
Amazing.
So, but now when I started doing farming, we had to find out solution for every challenge. And I forgot two things, Rajat. Plants also get infection. Plants are also attacked by pest. And how do you handle it? Deadly chemicals.
Yeah.
So, but through our experience, we figured out how to handle each stages and how to handle insects, how to handle infection through natural means.
Brilliant.
And the vegetables that we grow is more tastier, more healthier. And the other thing is, Rajat, the food that is grown using chemicals, they appear big, they appear good, but the nutrition that they carry is much, much less than what is grown organically.
Totally. Aesthetics, right? I mean, from outside, they look excellent.
That's true.
But they're not.
Yeah. See, very simple, Rajat. You know, there is a lot of similarity between soil health and our gut health. You know, so have you heard of many of our soil becoming infertile and not suitable for growing? Have you heard of that?
Left, right, and center. Yes.
Yeah. So what's the reason? Now, a soil can be fertile only when there are sufficient microorganism present in the soil.
Yeah.
Now, for example, there are three nutrition that a plant needs for its growth: nitrogen, phosphorus, and potash. Now, what do a conventional farmer use for nitrogen source? He puts urea.
Yeah.
But in traditionally, what we used to do is we used to source nitrogen from cow dung.
Right.
Now, what's the benefit? Now, when you use cow dung or you know, plants dry leaf to recycle the nutrition in your soil, what happens is you're replenishing the soil with good bacteria.
Right.
Now, for nitrogen, you need nitrogen fixing bacteria.
Right.
For phosphorus, you need phosphorus fixing bacteria. Every nutrition for the plant to absorb, it needs those bacteria to feed that nutrition from the soil into the root. So, when you use dry leaves or cow dung, you're replenishing the soil with these good bacteria naturally, and these good bacteria feed the plant, and the plant gets sufficient nutrition, it grows, and it brings out a very good fruit.
Yeah.
But what do? We use urea. Now, urea is a source of nitrogen. The plants grow very fast.
Yeah.
But what happens is you're killing the good bacteria there, because remember, urea is a salt, and salt kills bacteria. That's why we use salt in pickles. We don't want the bacteria in the pickles.
Yeah.
So now what's happening is we are killing the bacteria in the soil.
Yeah.
And now
the good bacteria.
Yeah. Now what's happening? The soil fertility goes down.
Yeah.
And you're getting a very artificially grown food. And what impact that what impact it causes in your body?
Yeah.
Less nutrition.
Yeah.
More chemicals. And you know, so we are not looking it from this perspective.
Yeah. We're not doing the 360 perspective.
Yeah. So which means unhealthy diet for chronic inflammation starts with unhealthy way of growing food, unhealthy way of preserving food, unhealthy way of processing food, unhealthy way of choosing food, unhealthy way of cooking food, and unhealthy way of eating food. All these 6 factors play a very important role when it comes to unhealthy diet. So, you know, we are not looking at these things. We are always just moving on with quick fixes. And that's not going to solve a problem. We are fixing a problem, we are creating a problem.
You know, why I'm smiling or amused by this is, as a farmer, you're happy to say anything about the chemical this, chemical that. But as a doctor, you're very reluctant to talk about drugs. Same story there, right?
Yeah.
We're taking a shortcut.
We're
not looking at the natural, the base, like why is it happening? And you're kind of talking, but not enough. You said something interesting yesterday to me or to Harshit, I think. you practice humanity rather than practicing a religion or something like that, you said.
That's right.
Say more. And how is it relevant for medicine?
Yeah. See, I liked our professor, Dr. B.M. Hegde,
Right.
who we look up so much. He's
By the way,
yeah,
sorry for interrupting you.
Yeah.
This is the only lecture. He was a guest lecturer. He's
Yeah.
never taught us.
Yeah, yeah.
And here was the only lecture that I remember from medical college, and I
Yeah.
don't remember anything else. That was the only one thing that I remember. He was talking about cardiovascular and heart, and in a very simple way, rather
That's
than
true.
complicating it.
That's true.
Please go
That's
on.
true. Yeah, no. So, he defines health very nicely. He says, he talks about two important things. One is love all humanity,
Uh-huh.
and the second is enthusiasm to work and to love.
Right.
So, I like how precisely he talks about these things, and when we talk about mental health, I like to talk more on these things, but I agree with what he said.
Yeah.
You know,
Enoch, so you've spoken about a lot of topics,
Yeah.
right, all over the
Yeah.
place and all that.
that's true.
Now, how within a minute,
Yeah.
what message do you want to give out there to the audience, youngsters, and people who are in their 80s and 70s and 60s and whatever else?
Yeah.
In a minute, what message do you want to give to them?
Yeah, I just want to tell our audience that if you have any chronic diseases, there is hope for you. That's the first thing.
Right.
Now, the message to the young people is that your energy, your enthusiasm, and your disease-free life is not going to continue unless and until you take sufficient precaution. So, the message for these two groups is that if you can do all that you can to prevent chronic inflammation, that is the young people, and for the older ones who are having chronic disease, if you can do certain things that can stop the disease process, that can stop chronic inflammation,
Or reverse.
yes, reverse it, there is a lot of hope.
Yeah.
So what do you do? Number one, follow healthy lifestyle, follow healthy diet, and do all you can to have a good mental health.
Right.
Now, these three things, if you can do, you can reverse disease. That has been our experience.
Right.
You can prevent disease, you can have a better quality of life and longevity.
That's right. So add more years to your life than years to your, like the other way around. Just extending your life is not good enough.
That's true.
Add quality to
Quality
your life.
of life.
Yeah.
And see, you have been saying that we need to deal with this in more detailed manner. Yes, we will go into every aspect of these three factors in detail, so that our audience have sufficient information to carry with them to handle these chronic diseases, or even some who are looking at preventing these chronic disease and have a better quality of life.
Totally. Enoch, it was an absolute pleasure. Thank you so much.
Nice being here, Rajat. It was fun.
Yeah, no, perfect.
Yeah.
Thank you so much. So keep looking, checking into our Miles of Meaning podcast. And for now, over and out. Keep smiling and smiling.